COVID-19 has caused a lot of panic and devastation all around the world. With the lockdown of cities, companies are forced to minimize or shut down operations, and this has been very bad for business. The economy has suffered greatly under the COVID-19 pandemic. One of the measures used to mitigate the economic impact on citizens is to practice social distancing. So, what is social distancing? Social distancing is a public health practice that aims to prevent sick people from interacting with healthy people and thus reduce opportunities for disease transmission. With COVID-19, social distancing aims to slow down the outbreak and reduce the chances of transmission to high-risk populations. This will reduce the impact on our healthcare system and its workers. So, why is this important? Take a look at this. The curve here represents the total number of infections that can take place without social distancing, and the line over here will represent the total capacity of our medical healthcare system. Without adequate measures, the total number of infections will exceed beyond the capacity of our healthcare system, and this will result in the collapse of our medical system. The main aim of social distancing is to flatten the curve and reduce the number of infections such that our healthcare system can handle the pandemic at all points in time. So, is it effective? History has shown that it is one of the most powerful measures at our disposal. If we look at the Spanish flu pandemic in 1918, comparing Philadelphia and St. Louis, the effectiveness of social distancing is very apparent. Philadelphia, which did not engage in social distancing, saw a huge upsurge in infections, whereas St. Louis carried out a highly effective social distancing measure by closing down churches, libraries, town halls, and banning mass gatherings or meetings of more than 20 people. So, how do we carry out social distancing? Firstly, avoid places with large gatherings. In Singapore, events with more than 250 people have been cancelled, and gatherings must comprise of less than 10 people. Secondly, while we cannot completely avoid going to public places altogether, we can practice physical distancing. The WHO recommendation is to maintain 1 meter between each other in public places. For the retailers and restaurants, they can put demarcations, limit the number of patrons, and mandate a 1 meter distance between people in queues and sitting areas. Further measures they can apply include providing signs to remind customers to maintain a safe distance, temperature taking for contact tracing, providing hand sanitizers, taking down orders to reduce queues, enabling mobile ordering and payments, or even integrating pre-ordering. For workplaces, employees and employers should try to reduce or remove non-essential contact. Some measures include working from home, reducing working proximity, using teleconferencing, staggering work hours, removing non-critical work and scaling down critical ones, and ensuring that meeting room seats are spaced out from one another. Sick workers must be mandated to stay home or seek medical attention. Monitoring and tracing should be done to allow for contact tracing in an emergency. There are also other measures that should be undertaken together with social distancing: testing of suspected carriers, contact tracing, washing hands with soap, isolation for the sick, and quarantine on those suspected to contract the virus. By practicing social distancing, companies will still be able to run and thus avoid a complete economic lockdown. Less businesses will be affected, and workers will still be able to carry out their work. This results in far less economic damage than a complete lockdown of the city. So, once the pandemic is over, we can recover relatively quickly. As such, social responsibility is key. Every single one of us must play our part to prevent the spread of the COVID-19 virus. The principles of social distancing must be upheld at all times, even if it means reducing contact with colleagues, friends, and family.